My name is Toby Farr. I research prescription drug abuse and the sociological reasons that influence the users. The reason this topic is relevant is because the abuse of prescription drugs is running rampant across the country. It affects all ages, adolescents, adults, and the elderly. The CDC states that in 2010, there were 22,134 deaths associated with prescription drug overdoses. That number is simply too high. Before researching this topic, my hypothesis was that the ease of getting medications results in how close the abuser is to the people that can provide the prescriptions to them, such as a doctor, nurse, or pharmacist. I also expect to find that hardships in life and peer pressure will have a strong impact on prescription drug abuse. I conducted my research by going online to the Texas Tech University Library website and finding relevant articles through the site. Martha Morgan and Whitney Brozzi examined prescription drug abuse in the elderly using the human ecological method. This method centered around the idea that people-to-people interactions are extremely important, as well as the interactions between the person and the environment that they are a part of. The picture here is of Bronfenbrenner's model. His model shows the human ecological method's levels, starting with the smallest, the microsystem, going to the highest, the macrosystem. The lowest level is simply a person's immediate family. From there, it expands out, ending with the macrosystem, the most impersonal level of the Bronfenbrenner model. Ryan Schroeder and Jason Ford both look into several factors that can influence adolescent drug abuse, such as the differential association theory and the social control theory. In the differential association theory, the primary focus is on the adolescent's peer influence and how it develops deviant behaviors like the urge to abuse prescriptions. Peers can include the adolescent's classmates, friends, or family. The social control theory is similar to the human ecological method, where it looks into the connections that individual has to others and how these people play into that person's life. Parental bonds and religiosity of the family structure is also examined in the social control theory. Christy Holtfretter, Michael Regig, and Erin Nicole O'Neill examine drug abuse focusing on the general strain theory. As the name implies, the general strain theory focuses on the strain that comes into a person's life in three ways: failure to achieve goals, loss of positive stimuli, and the appearance of negative stimuli. When the person's life is not going the way that they had intended, like dropping out of school or losing a partner, they often turn to deviant behavior like prescription drug abuse. The findings in my research support the first part of my hypothesis. Martha Morgan and Whitney Brozzi found that the ease of access that Beulah, their subject, had to her doctors and the prescription drugs that they would prescribe had a strong impact on the abuse of the drugs. They went on in their paper to note that when her daughter Abigail took control of her mother's medications, health treatments, and driving responsibilities, this greatly decreased her ease of access to the drugs, thus stopping the abuse of the drugs. This is consistent with Bronfenbrenner's model, showing how the environment that Beulah was in aided her drug abuse. My hypothesis was also confirmed by Schroeder and Ford when they found that peer pressure had a negative relation with drug abuse in adolescence, increasing the odds of abuse. This is consistent with the social control theory, since it had a fairly strong relationship with the medication abuse. They also showed that strong parental relationships had a positive result, decreasing the likelihood of abuse. And surprisingly, religiosity did not affect the chances. My hypothesis was not confirmed by Holtfretter et al.'s finding that hardships like being widowed did not increase prescription drug abuse, but confirmed at the same time that being in poor health and being depressed did increase the likelihood of prescription drug abuse. Through researching the topic, I expected to find that prescription drug abuse was a result of how easily the person had access to the abused drugs. I hypothesized that the ease of getting these medications results in how close the abuser is to the people that can provide the medications to them, whether that be the doctor, nurse, or pharmacist. This was confirmed as I found that prescription drug abuse was increased as a person had ease of access to the prescription drugs, such as when the person was in control of their own medications. I also expected to find that hardships in life and peer pressure would have a strong impact on prescription drug abuse. I found that peer pressure increased the odds, while closeness with parents decreased the odds of prescription drug abuse, and that hardships did not increase likelihood of abuse, as I had hypothesized. As for policy recommendations, I recommend that doctors and healthcare professionals increase space from patients so to decrease the likelihood of abuse. We should also keep more channels open for discussion about prescription drug abuse so that peer pressures and closeness to family can affect the odds of prescription drug abuse even greater.